Bullet points regarding abdomen and pelvis and perineum. Transumbilical and median plane divide the abdomen into four quadrants. Transversalis fascia lines most of the abdominal wall and covers the deep surface of transverse abdominal muscle. Campers and scarpas fascia are located in inferior part of abdominal subcutaneous tissue. Parietal peritoneum is internal to transversalis fascia and is separated from it by extraperitoneal fat. Anterolateral abdominal wall is bounded inferiorly by inguinal ligament and the pelvic bone. Central tendon of diaphragm has no bony attachments. Diaphragmatic crura arises from anterior surface of L1 L3 vertebra, anterior longitudinal ligament, intervertebral discs. Inferior margin of external oblique aponeurosis thickens and folds back on itself to form inguinal ligament. Inguinal ligament runs from ascis to pubic tubercle. Rectus muscle is anchored transversely by attachment to anterior layer of rectus sheath and tendinous intersections. Arcuate line form the inferior limit of posterior lamina of rectus sheath. Medial umbilical folds are remnants of occluded fetal umbilical arteries. Lateral umbilical folds cover the inferior epigastric vessels. Median umbilical fold is remnant of urachus. Lateral inguinal fossa is most common site for indirect inguinal hernia. Lateral inguinal fossa lie lateral to lateral umbilical folds. Median and lateral arcuate ligaments are thickenings of fascia covering psoas major and quadratus lumborum muscles respectively. Esophageal hiatus is an opening oval aperture in right diaphragmatic crus at T10. Cisterna chyli is a thin-walled sac from inferior end of thoracic duct. Pelvic splanchnic nerves can be distinguished from other splanchnic nerves in that they are unrelated to sympathetic trunks and are derived directly from ventral rami of S2 and S4. Psoas, also known as muscles of loin, passes inferolaterally and deep to the inguinal ligament to reach lesser trochanter of femur. Lumbar plexus is embedded in posterior part of psoas major. Inguinal canal contains spermatic cord in male and round ligament in female. Outpouching of transversalis fascia most common occur through deep inguinal ring. Inguinal ligament is reinforced in its most medial part by lacunar ligament. Iliopubic tract demarcates the inferior edge of deep inguinal ring. Testis develop in extraperitoneal connective tissue in superior lumbar region of posterior abdominal wall. Gubernaculum connects primordial testis to anterolateral wall at site of future deep inguinal ring. Gubernaculum is represented postnatally by scrotal ligament, which extends from testis to scrotal skin. Loops of cremaster muscle are formed by lowermost fascicles of internal oblique muscle arising from inguinal ligament. Cremastric fascia is derived from deep and superficial fascia of internal oblique muscles. Testis is covered by tunica vaginalis except at its posterior margin. Pampiniform plexus forms major portion of thermoregulatory system of testis. Lesser omentum connects the lesser curvature of stomach and proximal duodenum to the liver. Greater omentum are also known as policemen of peritoneal cavity. Portal triad consists of portal vein, hepatic artery, bile duct. Left gastro-omental artery arises from splenic artery and course along the greater curvature to anastomose with right gastro-omental artery. T16 to T9 gives sympathetic nerve supply of stomach. Duodenojejunal junction is supported by ligament of Treads, also known as suspensory muscle of duodenum. Superior mesenteric and splenic veins unite to form portal vein posterior to the neck of pancreas. Large intestine can be distinguished from small intestine by tinea coli, haustra, and omental appendices. Spleen is the largest lymphatic organ and is mobile structure entirely surrounded by peritoneum except at the hilum. Splenic artery is the largest branch of celiac trunk. Head of pancreas is embraced by C-shaped curve of duodenum to right of superior mesenteric vessels. Round ligament of liver is fibrous remnant of umbilical vein. Common hepatic artery extends from celiac trunk to origin of gastroduodenal artery. Proper hepatic artery extends from origin of gastroduodenal artery to its bifurcation into right and left hepatic branches. Mucosa of neck of gallbladder forms the spiral valve which regulates the flow of bile via cystic duct. Cystic artery originates from right hepatic artery in angle between common hepatic duct and cystic duct. Suprarenal glands are located between superomedial aspects of kidney and diaphragm. Superior suprarenal arteries originates from inferior phrenic artery. Middle suprarenal arteries receives blood supply from abdominal aorta. Inferior suprarenal arteries are provided by renal artery. Caput medusae is formed by dilation of anastomosis of paraumbilical veins of anterior abdominal wall with superficial epigastric veins. Renal hilum occurs as a vertical cleft at concave medial margin of each kidney. Suprarenal medulla is derived from neural crest cells associated with sympathetic nervous system. Midgut is physiologically herniated into proximal part of umbilical cord during initial embryological development. As midgut returns to abdominal cavity, it rotates 270 degrees around the axis of SMA. Appendicular artery is located in mesoappendix, while anterior cecal artery is located in superior ileocecal fold. Inferior ileocecal fold is avascular, unlike vermiform appendix. Pelvic outlet is caused by musculofacial pelvic diaphragm and inferiorly limits the pelvis. Lesser sciatic notch occurs as a concavity between ischial spine and ischial tuberosity. The greater sciatic notch is a large concavity superior to the ischial spine and is partially formed by ileus. Superior pubic rami that forms the acetabulum, while inferior rami forms the obturator foramen. Pubic crest occurs as a thickening on anterior body of pubis and hence laterally as a pubic tubercle. Pectineal pubic line is formed by oblique ridge on lateral part of superior pubic rami. In anatomical position, ASIS and anterosuperior iliac spine and anterior aspect of pubic symphysis lies in same vertical plane. Piriformis muscle cover the posterolateral wall of pelvis. Levator ani includes pubococcygeus, puborectalis, iliococcygeus muscle. Hip bones and obturator foramina form the lateral pelvic walls. Sciatic and pudendal nerves are two main nerves of sacral plexus. Sciatic nerve is the largest and broadest nerve in the body. Sciatic nerve is formed by ventral rami of L4-S3. Pudendal nerve is derived from anterior divisions of ventral rami of S2-S4. Pudendal nerve is main nerve of perineum and chief sensory nerve for external genitalia. Superior gluteal nerve arises from posterior divisions of ventral rami of L4 to S1. Inferior hypogastric plexus are formed by pelvic splanchnic nerves and hypogastric nerves. Testicular artery does not enter the true pelvis as it follows testis through the inguinal canal into scrotum. Internal iliac artery is the artery of pelvis. Ureters are 25 to 30 centimeters long, retroperitoneal muscular tubes. Pelvic part of ureter crosses the bifurcation of common iliac artery. Uvula of bladder is more prominent in elderly males. Sympathetic fibers to the bladder are derived from T11 to L2. Parasympathetic fibers to the bladder are derived from pelvic splanchnic nerves. Prostatic urethra is the widest and most dilatable part of male urethra. Urethral crest is the median ridge on internal surface of posterior wall of prostatic urethra. Prostatic utricle is an embryonic remnant of uterus and part of vagina. Ductus deferens begins in tail of epididymis and ascends in spermatic cord. Seminal vesicles lie between fundus of urinary bladder and rectum and they do not store sperm. Posterior fornix is the deepest part of vagina and is closely related to rectouterine pouch. Vaginal fornix is the recess around the cervix. Uterus is usually anteverted and anteflexed in adults and its position changes with degree of fullness of bladder and rectum. Cervical canal is broadest at its middle part. Suspensory ligament of ovary is a superior prolongation of peritoneum and of broad ligament over the vessels. Mesoovarium is the part of broad ligament by which ovary is suspended. Mesosalpinx is the part of broad ligament forming mesentery of uterine tube. Distal end of ovary connects to the lateral wall of pelvis by suspensory ligament of ovary. Parasympathetic fibers in the ovarian plexus are derived from vagus nerve. Rectosigmoid junction lies anterior to the S3 vertebra. Urogenital triangle containing root of scrotum and penis in males and external genitalia in females lies anterior to anal triangle. Bulbospongiosus, external anal sphincter, and superficial and deep transverse perineal muscles converge at site of perineal body. Pudendal canal is the space within obturator fascia which covers the medial aspect of obturator internus and lines the lateral wall of ischioanal fossa. Pudendal nerve splits towards the distal end of pudendal canal, giving rise to the perineal nerves and continuing as the dorsal nerve of penis and clitoris. Anal columns contain the terminal branches of superior rectal artery and vein. Pectinate line indicates the junction of superior and inferior part of anal canal. Superior to pectinate line, the internal rectal venous plexus drains chiefly into superior rectal vein, a tributary of inferior mesenteric vein and portal system. Inferior to pectinate line, the internal rectus plexus drains into inferior rectal veins, tributaries to the caval venous system. Superior to pectinate line, the innervation is visceral. Inferior to pectinate line, the innervation is somatic. Lumen of spongy urethra expands in the bulb of penis to form intrabulbar fossa and in glans penis to form fossa navicularis. Anterior aspect of scrotum is supplied by anterior scrotal nerves derived from ilioinguinal nerve and by genital branch of genitofemoral nerve. Deep arteries of penis supply cavernous spaces in erectile tissue of corpora cavernosa. Ischio-cavernous muscles force blood from cavernous spaces in the crura into distal part of corpora cavernosa, thus increasing penile turgidity. Vestibule is the space between labia minora and containing the opening of urethra, vagina, and duct of greater and lesser vestibular glands. Greater vestibular glands are partly overlapped posteriorly by vestibular bulbs. Labia minora are enclosed in pudendal cleft within labia majora, immediately surrounding the vestibule of vagina. Except for the most cranial portion, appendix, epididymis, mesonephric ducts persist and form main genital ducts. The only part remaining from mesonephric system are euphuron, pareuphron, and Gartner's duct. Vaginal fornices are wing-like vaginal expansions around the end of uterus and are paramesonephric origin. Rapid elongation of genital tubercle in the male gives rise to phallus. Genital swellings known in male as scrotal swellings arise in inguinal region and develop caudally. Urethral folds do not fuse as in male but develop into labia minora. Descent of gonads is considerably less in females than in males and ovaries settle just below the rim of true pelvis. Cranial genital ligament forms the suspensory ligament of ovary, while caudal genital filament forms the ligament of ovary proper and round ligament of uterus. Bladder is relatively free within extraperitoneal subcutaneous fatty tissue except for neck, head, held firmly by puboprostatic ligaments in males and pubovesical ligaments in female. Conical glans penis is formed by direct expansion of corpus spongiosum. Deep arteries of penis supply cavernous spinous spaces in the rectal tissue of corpora cavernosa. Lesser vestibular glands are small glands on each side of vestibule that open into it between urethral and vaginal orifices. Perineal gland is the major structure incised during median episiotomy for childbirth. Superior rectal artery is the direct continuation of inferior mesenteric artery. When empty, the adult urinary bladder is in lesser pelvis, lying posterior and slightly superior to pubic bones. The short intermediate part extending from prostatic urethra to spongy urethra is narrowest and least distensible part of urethra. Paraurethral glands are homologous to prostate. Deep transverse perineus muscle is immediately superior to perineal membrane. The differential artery usually arises from inferior vesical artery and terminates by anastomosing with testicular artery posterior to testis. Puborectalis is responsible for anorectal angle, which is important in maintaining fecal incontinence. Levator ana is the largest and most important muscle in pelvic floor. The internal iliac artery begins at level of fourth disc between L5 and S1, where it crossed by the ureter. Superior end of vagina surrounds the cervix, while the lower end passes in antero-inferiorly through pelvic floor to open in the vestibule. Anterior part of tendinous arch of pelvic fascia forms the puboprostatic ligament in males or pubovesical ligament in females. Posterior part of tendinous arch of pelvic fascia forms the sacrogenital ligaments from sacrum around the side of rectum to attach to prostate in males or vagina in females.